Medications play a vital role in managing atherosclerosis by targeting the underlying causes and reducing the risk of life-threatening events. While lifestyle changes like diet and exercise are important, medications can directly lower cholesterol, control blood pressure, and prevent blood clots. This combination approach helps slow disease progression and protects the heart and blood vessels. Next, let's dive into the first and perhaps most well-known medication group, statins, starting with atorvastatin. Atorvastatin, a member of the statin family, is one of the most important drugs for lowering cholesterol in patients with atherosclerosis. It's typically taken once daily and has been shown to significantly reduce the risk of heart attack and stroke. By lowering cholesterol, especially LDL or bad cholesterol, atorvastatin helps slow the buildup of plaque in the arteries. This makes it a cornerstone in the management of atherosclerosis. But how does it actually work inside the body? Let's take a closer look at its mechanism of action. Atorvastatin works by inhibiting an enzyme in the liver called HMG-CoA reductase. This enzyme is crucial for producing cholesterol. By blocking it, atorvastatin decreases the liver's cholesterol synthesis. As a result, the liver increases the number of LDL receptors, which helps clear more LDL cholesterol from the blood. Beyond just lowering cholesterol, atorvastatin also has anti-inflammatory effects and helps stabilize plaques, making them less likely to rupture and cause a heart attack or stroke. Aspirin, especially in low doses, is widely used to prevent heart attacks and strokes in people with atherosclerosis. It works by reducing the risk of blood clots forming in narrowed arteries, which can block blood flow and cause serious events. Typically, patients take 81 to 100 mg per day. Aspirin is a simple, affordable, and effective way to lower the risk of complications, especially in those who have already experienced a heart attack or stroke. Aspirin works by irreversibly inhibiting an enzyme called COX-1 in platelets. This action decreases the production of a substance called thromboxane A2, which is responsible for making platelets stick together and form clots. By reducing platelet aggregation, aspirin lowers the chance of dangerous clots forming in narrowed or damaged arteries. This is why it's such a key medication for people at risk of heart attack or stroke. Clopidogrel is another important antiplatelet medication, often used when patients cannot tolerate aspirin or after procedures like coronary stent placement. Sometimes it's combined with aspirin in what's called dual antiplatelet therapy. Clopidogrel helps prevent blood clots in damaged arteries, further reducing the risk of heart attack and stroke. Let's see how it works at the cellular level. Clopidogrel works by blocking the P2Y12 receptor on the surface of platelets. This prevents platelets from becoming activated and sticking together, which is crucial for clot formation. By reducing platelet activation, clopidogrel lowers the risk of dangerous clots forming in arteries that are already narrowed or damaged by atherosclerosis. This makes it a valuable tool in preventing heart attacks and strokes, especially after certain heart procedures. Beta blockers such as metoprolol are commonly prescribed to patients with coronary artery disease. These medications help control the heart rate and reduce the amount of work the heart has to do. By lowering both heart rate and blood pressure, beta blockers decrease the heart's oxygen demand, which can help prevent heart attacks and protect the heart muscle from further damage. Beta blockers work by blocking beta-1 receptors in the heart. These receptors normally respond to adrenaline and other stress hormones, increasing heart rate and force of contraction. By blocking them, beta blockers slow the heart rate and lower blood pressure. This reduces the heart's oxygen demand and helps prevent further damage, especially in people with narrowed or damaged arteries. ACE inhibitors like enalapril and lisinopril are used in patients with hypertension, diabetes, or heart failure. These medications protect blood vessels and help slow the progression of atherosclerosis. By lowering blood pressure and reducing the workload on the heart, ACE inhibitors play a key role in long-term cardiovascular health. ACE inhibitors work by blocking the angiotensin-converting enzyme ACE, which is involved in producing angiotensin II, a hormone that narrows blood vessels and raises blood pressure. By inhibiting ACE, these drugs lower levels of angiotensin II and aldosterone, leading to relaxed blood vessels, lower blood pressure, and reduced cardiac workload. They also improve the function of the blood vessel lining, offering additional protection against atherosclerosis.